So everybody know where their eyebrows are in the back. And very commonly they say eyebrows on fleek. Next is your eyelids. So eyelids are modified folds of skin which protects your eyeball. So main function is when they blink, they spread the tear film, or the tears, they coat your eye, and they prevent dehydration. So the upper eyelid ends at the eyebrows, and the lower lid merges into the cheek. So if your eyebrows are hashtag on fleek, your lower lid ends on your on cheek, hashtag on cheek. So you have your brows, eyelids, upper eyelid, lower eyelid, and then the space between your upper and lower eyelid is called your palpebral fissure. So you have a vertical and horizontal palpebral fissure, which measures about 27 to 30 horizontally and about 8 to 10 millimeters vertically. So the eyelids is just a thin structure, but the eyelids contain so many layers. So they have 7 layers. So this is your skin, your muscles of retraction, your orbital septum, your orbital fat, the muscles of retraction, the tarsus, and the conjunctiva. So many structures so many layers for one structure. So first is your skin and subcutaneous tissue. So this is a very thin, loose, and elastic tissue. And the skin of the eyelids are the thinnest on the body. They contain a few hair follicles and they have no subcutaneous fat. Behind your eyelids is your muscles of protraction. So muscles of protraction means it closes the eye. So the muscle here is known as your orbicularis oculi. And anytime you hear the word oculi, so that means something related to the eye. So your orbicularis oculi has 3 parts. You have your orbital muscle, preseptal, and your pretarsal muscle. Okay, so this muscle is innervated by cranial nerve 7. So if you think about cranial nerve 7 is like a hook. Forms like a hook. So if you hook the eye, it closes the eye. So orbicularis closes the eye, innervated by cranial nerve 7. So behind your orbicularis oculi, there's a thin band here. So this is known as your orbital septum. So this is a fascia behind your orbicularis oculi. So this lies between the orbital rim and the tarsus. So this is the bone. So this is your orbital rim. And this is the tarsus. So in between them is your orbital septum. So this is very important because the function of your orbital septum is it serves as a barrier to blood, infection, and inflammation. Okay, so remember this structure. And behind this orbital septum, this yellow structure here is just your orbital fat. So anytime that you had an eyelid trauma and you see fat coming out from the eyelids, so that means your orbital septum has been violated. So you are prone to infection and inflammation. So that's why it's an important structure. If you don't see any fat coming out of eyelid trauma, then more likely the orbital septum is intact. Next is your muscles of retraction. So protraction is closing the eyes, retraction is opening the eyes or opening the eyelid. So you have an upper and lower muscles of retraction. In the upper eyelid, you have your levator palpebrae superioris and your superior tarsal muscle, also known as your Mueller muscle. For the lower lids, these are your capsulopalpebral fascia and your inferior tarsal muscle. Okay, so what nerve innervates this muscle? Anybody? So if cranial nerve 7 innervates your orbicularis oculi and it closes the eyelids, so what nerve innervates your muscles of retraction? So you have cranial nerve 3. Okay, so if you think about cranial nerve 3, it's like a pillar, no? If you use the Roman, like a pillar. So putting a pillar in your eye opens your eye. Okay, so 7 closes and 3 opens. Next structure, the eyelid, is your tarsus. So this is a dense fibrous tissue which gives shape to your eyelids, and it's mainly a supporting structure. So here, no, so behind the muscle in the lower part, so there's a fibrous tissue, so that is known as your tarsus. And lastly, behind it, no, is your palpebral conjunctiva. So this is the posterior layer of a mucous membrane, and this adheres firmly to your tarsus. So basically, when you pull your lower lids, you're seeing your inferior palpebral conjunctiva. If you flip your eyelids in the upper eyelid, then you also see the conjunctiva. So in the clinics, you're very familiar now with a pinkish conjunctiva. You're looking for jaundice or something. No, if dehydrated, then it's pale conjunctiva. So this is the last layer of your eyelid. And then if you look closely, no, at the lid margins, we will segregate this into anterior margin and posterior margin. Okay, so anterior to this imaginary line are your eyelashes. No? And posterior to that yellow imaginary line are your meibomian glands. You see these bumpy structures? So those are your meibomian glands. So in the anterior margin of the eyelids, you have your lashes, and you have your glands of Zeiss and Moll, which are modified sebaceous glands and sweat glands respectively. And then in your posterior margin, you have your meibomian gland, and underneath it or within it is your tarsal gland. So what is the function of your meibomian gland? Any idea? Okay, so your meibomian gland secretes sebum or oil. So your lacrimal gland secretes aqueous, no, or tears. So tears alone will dry up, no, through heat. But if you put oil over your tears, it will dry up much later. No? So it serves as a protecting barrier to your tears so that it does not evaporate quickly. So pointed with the black arrows are small bumpy structures. So those are your meibomian glands. So your meibomian glands, no? So they open up into the tarsus. So later, if you've experienced in vernacular binggit, no, bujinggit, no, so those are inflammation which says that there are trapped oil or infection in your meibomian glands. No, so which starts from blockage or infection coming out from your meibomian gland. No? So far, any questions? Am I clear with the structures? Okay. So next is your lacrimal apparatus. So your lacrimal apparatus is composed of your lacrimal gland, your punctum canaliculi, your lacrimal sac, and your nasolacrimal duct. So if this is your eye, if you remember, the roof, no, on the lateral part contains your lacrimal gland, and then the medial wall contains your lacrimal sac. So when the lacrimal gland produces tears, no, it pulls into the eye, and then it drains into the upper and lower punctum, drains into the sac, and then into your nasolacrimal duct. So sometimes when you cry, you notice that you will also have a runny nose. No? So it's basically more like connected. Okay, so the lacrimal gland is located at the temporal part of the frontal bone. So this is an exocrine gland. So this secretes a serous secretion or a watery secretion. And very easily remember, the lacrimal gland is supplied by your lacrimal artery. So easy, easy. Innervated by your lacrimal nerve. So very easy to remember. No? Lacrimal gland, lacrimal artery, lacrimal nerve. So sensory part is your lacrimal nerve, secretory part is through your great petrosal nerve, and your sympathetics. So there are, lacrimal gland is the main gland, no? But there are also smaller glands, also known as your accessory lacrimal glands. So which are located in your palpebral conjunctiva. So these are your glands of Krauss and glands of Wolfring, and only composes about 10% of your total lacrimal secretory mass. So as your lacrimal glands continuously produce tears, again, they pool in your eyelids. And then the fluid gathers and drains into your lacrimal punctum. Okay. So when you blink, pressure develops and it pushes the water into your lacrimal sac and then eventually drains into your nasolacrimal duct. So if you look at the mirror, or if you look at pictures, no, in the middle part there's a very small hole, no, very small canal. Here in the lower punctum and the upper punctum. So that is where your drain. That is where your tears drain.
Upper and lower
So
punctum.
this punctum is very small. Now when you cry, there's an overfill or overflow of tears. Not because when you cry, you produce so much tears that the punctum cannot drain them all. So tearing is known as excess tear production, but if you have excess tear production and it does not drain, it is called an epiphora. So when you're crying, you have both tearing, which is excess tears, and then the overflow because you keep on crying. That is called epiphora. So the excess water that is not drained by your punctum is called an epiphora. Okay, so another structure after your punctum is your canaliculus, canaliculi. 90% of the people will have a common canaliculi. So that means that your upper and lower canaliculi will converge into one tube, called the common canaliculi, and then it drains into your lacrimal sac. But some people have type B and type C. So B meaning the punctum drains directly into the sac, and type C, it also drains directly but into separate areas. Okay. So the lacrimal sac is like a USB, USB A, B, and C. So to prevent reflux of tears, so when your tears drain into the lacrimal sac, there are also valves. So the superior valve is known as your valve of Rosen-Muller, and the inferior valve is known as your valve of Hasner. So the valve of Rosen-Muller prevents reflux from tears from the lacrimal sac back into the punctum. Okay? And the valve of Hasner prevents reflux from your nasal cavity back into the nasolacrimal duct. So one of the things that you should remember is the valve of Hasner, because the valve of Hasner is involved as a pathology for patients with a congenital nasolacrimal duct obstruction. So later in ophthalmology, you would know that there is an inflammation involving the nasolacrimal gland. If it happens in a child, then most likely the pathology involves the valve of Hasner. Next, let's go to the eyeball. Okay, so interactive. Do you know the parts of the eye? So if one can name the letter and give the part. Letter A, retina. retina. So next, G, iris. Anybody named Iris here? Nah. Dili ophthalmologist among parents. So G, iris. Next. D, lens. Okay, correct. C, optic nerve. Okay. Next. F, that was sclera. Okay. Letter E, cornea. Last, letter B, macula. Okay, no? So perfect. And data. Okay, no? So these are some of the very basic parts of the eye. So basically you got them all. Okay, so the eye, no? So also known as your eyeball or globe. So this is not a true sphere, meaning it's not a circle. So what is the shape of the eye if it's not a circle? Oblate spheroid. So the eyeball is not a true sphere. So the axial length is about 23 millimeters, meaning the length from the anterior, from the cornea to the back part of the eye is about 22 to 24.5. No? So on average, it's 23.3. And then as mentioned, the volume is about 6 to 7 ml. No? So it's 1/5 of the volume of your orbit. So before the eyeball, no? So there's an outer coating. So this is called your conjunctiva. Okay. So your conjunctiva is a thin, transparent mucous membrane composed of stratified columnar and squamous epithelium, and this contains numerous goblet cells. And they also have a rich vascular network. So if you look at the eye, if you look at the conjunctiva, there's so many blood vessels. So the conjunctiva is also very sensitive. No, it has feelings, so it receives innervation from the ophthalmic nerve of your trigeminal nerve. So there are parts of the conjunctiva. So as mentioned, the back part of your eyelid is called your palpebral conjunctiva. So back part of the eyelid and directly behind it is your palpebral conjunctiva. And number two, you have your bulbar conjunctiva. So mainly it's, if you look at your palpebral fissure, so the conjunctiva that you directly see is your bulbar conjunctiva. And then lastly is where your bulbar conjunctiva and your palpebral conjunctiva meet. So this is known as your fornicial conjunctiva, or basically just known as your fornix. So many layers, so many descriptions, they're just conjunctiva, but they're broken into different parts. So I wonder why you. So it makes our life easier on that if it's just conjunctiva. Next is your Tenon's capsule. So this is also known as your fascia bulbi. So this lies directly behind your bulbar conjunctiva and before the sclera. So this is an envelope of fibrous membrane which fuses from the limbus up to the optic nerve sheath. So this is the cavity within which the globe moves. Okay, no? So if the red structures are your conjunctiva and the white is your sclera, no, there's an imaginary capsule, no, which highlighted in blue is your Tenon's capsule. So check ligaments are tenon fascia, which are continuous with your muscle fascia. So muscles are also inserted within the sclera. So the tissue known there is your check ligaments. So next is your sclera. So the sclera is a fibrous outer protective coating of the eye, made almost entirely of collagen. So it is dense and white. Okay. So in this photo, so that very obvious white structure, no, is basically your sclera. But before the sclera, there's your conjunctiva and your tenons. And then before your main sclera, we also have a episclera. So this is a very thin layer of elastic tissue, which is the outer surface of your anterior sclera. It contains blood vessels, which mainly nourishes your sclera. So, as mentioned earlier, muscles are inserted into the sclera. And when the muscles are inserted, that sclera is very thin. So where the muscles are inserted is the thinnest portion of your sclera. So they're about 0.3 millimeters in thickness. Next is your cornea. So this reflectile or very transparent part of the eye, which you can see a reflection. No? So the cornea is a transparent tissue. It's optically clear, but it's very reflective. So this is inserted into the sclera at the level of the limbus. So the limbus is an imaginary line between your cornea and sclera. So where your cornea and sclera meet, no, that is what we call as a limbus. So if you look at the eye, you won't see any structure. No? So it's just an imaginary area where your cornea and sclera meets. So the cornea is important because this is the main refractive component of the eye, which is about 43 diopters. Meaning, if light passes through the eye, it's the cornea that gives the most refraction. So any problems with the cornea directly leads to an impaired vision. So on dimensions, it's 11 by 12 millimeters vertically by horizontally, meaning it's long, a little bit longer horizontally. So thickness is about 550 micrometers at the central cornea, and it's about 1,000 micrometers at the periphery. Okay, no? So cornea, just one structure, but again, so many layers. So the cornea has 5 layers from outside going in. So you have your epithelium, your Bowman's layer, the stroma, the Descemet's membrane, and the endothelium. Okay, so if you look at, so this is all the cornea, and they have different layers, and the thickest layer would be your stroma, and just a single layer of endothelium. So let's go one by one. So the very front layer is known as your epithelium. So this is continuous with your conjunctiva. So it is composed of 5 to 6 layers of basal, wing, and surface cells, and basically just acts as a physiologic barrier. Behind the epithelium is your Bowman's layer. So this is an acellular portion of the stroma, composed of tough layer of collagen fibrils, and it is replaced by scar tissue if it is injured. So if you see a cornea, no, which is normally clear, and you see whitish structures, that means the Bowman's layer has been violated, and when it healed, it developed into a scar tissue. Next is your corneal stroma. No? So this is 90% of your corneal thickness. So this is the bulk of your cornea. It's composed of collagen fibrils, ground substance of proteoglycans, and keratocytes. So this is arranged in a regular intertwining arrangement. Next is your Descemet's membrane, just basically the basal lamina of the endothelium, and this is considered a true basement membrane. And then lastly is your endothelium, which is a single layer of hexagonal cells. And as you grow older, there is a continuous loss of endothelial cells. So when we are born, we have about 20,000 cells per square millimeters. And then when we reach an elderly age, no, not probably 70s to 80s, then the cells dwindle down to about 2,000. So a very large decrease. So as they die down, unfortunately, these cells do not regenerate. So instead, when there is damaged endothelium, the remaining endothelium enlarges and they fill up the empty spaces. Okay, so this is called a specular microscopy, where this machine takes a photo of your endothelium. So if you look at the endothelium, it's like mga black and white piatos. So hexagonal structures. So this is a normal endothelium. So this is not a zoomed view, no, but this is an abnormal endothelium where the rest are damaged, and so the remaining endothelial cells enlarge and fill up the spaces. So when you're shown this, that means this is very large endothelial cells, meaning the eye has undergone damage. So this happens when you have endothelial dysfunction, or basically you have an endothelial dysfunction when you have abnormal endothelial cells. So why is this important? Because when you have endothelial dysfunction, the cornea begins to become hazy or cloudy. So instead of being clear, now it becomes edematous. So if you look at this photo, it's not as clear. No? So that means you have endothelial damage. So your endothelium is very important. No? So the endothelium contains sodium-potassium ATPase pump. So this regulates the flow of electrolytes and water. And the endothelium is responsible for detergescence. So detergescence just means that it keeps the eye in a relative state of dehydration. So not so much water. So it keeps the eye a little bit dehydrated. So that is what it means to become detergescence. So when you have the right amount of water, a good function of your endothelial cells, and then your stroma is healthy, then your cornea will be clear. So clarity is due to the uniform structure of your cornea, specifically the structures noted in your stroma. The cornea is also avascular, no? So there are no blood vessels seen in your cornea. And then the cornea should be kept in a relative state of dehydration or detergescence. Okay, so detergescence means that you have a healthy endothelial layer. Okay, so remember these three qualities of the cornea to make it clear. So uniform structure, avascular, and good endothelium function, or the cornea is in a state of detergescence. So where does the cornea receive its nutrition? So it receives nutrition from the limbal vessels, from the aqueous, from your tears, and from oxygen. So not including the sunlight. So we do not have photosynthesis. That's only for plants. Okay. Some of the students answered before. So the cornea receives nutrition from sunlight daw. So it's from your limbal vessels, aqueous, tears, and your oxygen. So just like your conjunctiva, the cornea is innervated by your ophthalmic nerve. You're using Bates when you're first year for your second year. Okay. So you're using Bates for physical examination. So there are segments in Bates where it tells you how to examine the eye, correct?
Yes.
Do you remember any examination?
Finger wiggle test.
Finger following. What else?
Finger wiggle.
Finger wiggle.
EOM.
So, do you remember this examination?
Yes. Katong sa
Okay, so what is this examination called?
corneal reflex. Corneal reflex to?
So this test for your corneal blink reflex. So this is known as your cotton whisk test. So our Indian friend here in the photo, you use a cotton pledget, you make a whisk, and then you try to touch the cornea. And a normal examination is that it's very sensitive, so usually the patients would blink due to very sensitivity, even to very light touch. Okay, so trigeminal nerve, no? Cranial nerve 5. Again, what nerve innervates your eyelids? What closes the eyelids? 7. So if you're asked, no, for blink reflex, so sensation is cranial nerve 5 and the motor should be 7. Okay. So when we examine patients under the slit lamp or under the microscope, this is what we normally see. It's not very clear na in the photo, but that is an eye seen under magnification under the slit lamp. So this white structure, no? When we pass light through the eye and we make the light to a very thin beam, then we're able to see the cornea. So this is the cornea in high magnification. So we just imagine that it has 5 layers. The very front part, the epithelium, the very back part, the endothelium, and everything in between is your stroma. So this is what we see when we examine patients. Are you familiar with this movie? Are you familiar with this scene in a movie? Are you familiar with the code? Okay, no? So this movie, so Iris by the Goo Goo Dolls is the soundtrack of the movie from the movie City of Angels. Okay, so this is scene from City of Angels. So up to you if you want to watch the movie. So the iris. Okay, so the iris is part of your uveal tract. So the uveal tract is made up of your iris, ciliary body, and choroid. Okay. So the uveal tract is the middle vascular layer of the eye. It is protected by the cornea and the sclera, and this contributes to the retinal blood supply. So first part of the uveal tract, no, is the iris. They got so many structures, so many parts. No? So we don't know why, no? But that's the way the eye is made. So the iris is located in front of the lens. So this has a central round aperture. No? This central round aperture, also known as your pupil. And this divides the eye into, the inner part of the eye into anterior and posterior chambers. So here, commonly the iris is brown, no? But in some drawing photos, blue or whatever color, it depends on the amount of melanin the patient has. No? So here, the iris in this photo or drawing is blue. Okay. So as mentioned, it divides the eye into anterior and posterior chamber. So the space between the iris and the back part of your cornea is known as your anterior chamber. And the space between the iris and the lens is known as your posterior chamber. Okay, so there are spaces, no, in between or in front and at the back part of your iris. So the iris is made of blood vessels and connective tissues or muscles. And then, as mentioned, your eye color or iris color is determined by the amount of melanocytes and pigments. The greater amount leads to darker colors, while lighter colors contain fewer amounts of melanocytes and pigments. So mostly for us Asians, we have highly pigmented genes or structures. So we have brown. Europeans, Americans, they might have lighter irises, so they have less melanin or melanocytes. So the function of the iris is it controls the amount of light entering the eye by controlling the size of your pupil. So when the eyes constrict, no, also known as miosis, this is due to a parasympathetic function, and this is due to the presence of bright light. No? So when light hits your eye, the eyes would constrict. Dilation, no, or also known as mydriasis, is a sympathetic function. No? So if the room is dark, your eyes will dilate. I think you all know, no, flight and fright. Well, it's a sympathetic, so when you're scared, your eyes are dilated. So in ophthalmology, we call it meiosis and mydriasis. So meiosis starts with M, both of them M, no? But the next letter is I. So I has a dot, so that means it's constriction. Mydriasis is wide, no wide, so mydriasis is dilation. Okay, so if you hear the words meiosis and mydriasis, so it's constriction and dilation. So the next part of your uveal tract is your ciliary body. So in this image here, the ciliary body. Okay, so the ciliary body is this triangular, no, cross section noted here. So the function of your ciliary body is that there's a ciliary process and a ciliary muscle. So the ciliary processes produce aqueous humor, no, or fluid inside the eye, and your ciliary muscle contracts or relaxes the zonular lens zonular fibers. So this would control the shape of your lens. The next is your choroid. So the choroid is the posterior segment of the uveal tract, which is located between the retina and the sclera. It's composed of 3 layers of blood vessels, mainly with your choriocapillaries, no, which is the internal portion of your blood vessels. So basically, the function of your choroid is that it nourishes the outer portion of your retina. Okay, so you have your iris, the very front part, the ciliary body, and then once it goes to the back part, it becomes your choroid. All three structures, no, is known as your uveal tract. No, so uveal tract is composed of your ICC, iris, choroid, ciliary body. So it's different from your international criminal court, ICC. Okay, so the ciliary body, no, basically your ciliary processes, they produce aqueous humor. So aqueous humor is a clear fluid that nourishes and inflates the eye. So this enters the anterior chamber through the pupils and exits the eye through your trabecular meshwork and your Schlepp's canal, which are known as the outflow apparatus of the internal eye. So on cross section, so this is your ciliary body. No? So you have your ciliary processes. So the ciliary processes will produce or create aqueous humor. It will pass through the posterior chamber, no, the space between the iris and the lens. And then in order to nourish the other structures, it goes out through the pupil. No? Because the pupil is just like a hole. So it comes out here, it stays in your anterior chamber, it nourishes, does its function. Then eventually they go to what we call as your angles, where in the angles you would find your trabecular meshwork and your Schlepp's canal. And then it would drain and then drain outside to your conjunctiva. Okay, so there's a continuous production of your aqueous humor, and then there's also continuous leading out of it from the body. So far, any questions? So I try to make it simple, no? So just breaking down the parts of the eye, its common functions. No? So not so much with the technicalities, but just how it looks like, what they are, what they're made of, and what their purpose is in the eye. here again, this white light is the cornea, and then this orange light, when we see it through the microscope, reflects into the iris. And then the pupils is very big. No, but do you remember I said that if light enters the eye, the pupils should constrict or become myotic. So, di kay klaro, no? Anyway, no, so you would see here that the light in the iris is located in the superior and inferior area. So when there's light, it should become constricting. No? So the light bouncing on the iris should be closer to one another. But why is it in this photo, the iris looks large? I mean, the pupils looks large. And why are the light on the iris very far apart? So this eye, despite having a light, is not myotic, no? It's mydriatic, no? Or it's dilated. I'm not sure why, no? Because this is just a photo. But the most likely explanation is that the patient or this person might have been given dilating drops. So dilating drops increases the pupil size so that we're able, as ophthalmologists or as students or as healthcare professionals, we are able to clearly see the back structures of the eye. In order to see the back structures of the eye, we need to use light. No, but if we use light without any aid from medications, the pupils will constrict. So it's hard for us to examine what's in the back part of the eye. So we put in dilating drops or mydriatic drops to make your pupils dilated, constrict the muscles, and then examine the other parts of the eye. So here you also see a very thin light, no? Very thin structure. So directly behind the iris is the lens. So probably I'll stop here for now. So I think I've said a lot about some structures of the eye. So we tackled about the adnexa, the bones, some of the common innervations, and then the anterior segment, or the anterior portion of the eye. So in the next meeting, we'll be talking about the posterior segment, from the lens to the retina, the optic nerve, and then lastly with your muscles. Okay, so are there any questions, clarifications, or anything you want to know with regards to what I've discussed today? So I'm free to answer any questions. So it's first day, but so many already, so many information. So hopefully you've learned something new today and something new about the eye. Okay, so if there are no more questions, I think this is it for today. And for future meetings, sometimes maybe it's in person or sometimes it's gonna be online. So if I'm far away from our clinics, no problem, online. Okay, so if there are no questions, thank you for listening.